epidemiologist and currently an Eyes High postdoctoral associate here at the University of Calgary with Professor Stephen Friedman. My research interests are in emerging diseases, and among other things, I've previously done research on Zika virus, plague, and MERS coronavirus. In late January of 2020, around the time when it was becoming apparent that the novel coronavirus might spread around the world and potentially become a pandemic, we started discussing with pediatric emergency research specialists from across Canada how we could set up a multi-center study on children who have COVID-19. And our research questions were, what does COVID-19 look like in children? What are the clinical characteristics and symptoms that children experience? What factors make some children more likely to be infected? And in children who are infected, what makes some children more likely to have severe outcomes of disease? We were also curious about how best we can provide care for children who have this disease. Some research has already been done in this area, but there haven't been very many robust studies. We do know that reported infections in children are quite rare. Only about 2% of all the reported infections in countries such as China, Italy, Spain, and the United States are in children. Children are also more likely to experience a mild or asymptomatic illness. And this is really interesting because maybe even with asymptomatic illness, these children may present some sort of risk for household transmission or community transmission. However, in some children, especially very young children and children who have other conditions, there is a high risk of hospitalization due to COVID-19. For our own study, we had the great opportunity to build upon a study that already exists across 70 sites across the world. And this study looks at predictors of severe pneumonia. And my supervisor, Professor Stephen Friedman, is involved in this study already. So what we were able to do is reach out to all of the sites that are already participating in the study on pneumonia and ask them, would you like to participate in a study on COVID-19? And this way, we were able to rapidly have the involvement of 57 sites across the world, including in Canada, the United States, Australia, New Zealand, South America, Europe, and Singapore. In total, we hope we can enroll across these sites about 12,500 children, and this would be about 200 or 250 children at each of the sites. And how this study is going to work is that we're going to look for children who present to the emergency department with symptoms or other risk factors for having the viral infection that causes this COVID-19 disease. Then these children are going to be tested for the virus, and at the point that we enroll the children, we won't know yet if they're positive or negative for the virus. So we're going to end up with a group positive and a group negative. We're going to collect information on these children, including risk factors for infection, what their medical history and demographics are, what tests and imaging have been done on these children, and what care have they received while at the hospital and earlier. We're also going to do a follow-up then, following these children prospectively, finding out at 2 weeks after their initial visit, what happened during this child's illness, what other symptoms did they experience, and how did the illness end? What was the child's outcome? We're also going to do a follow-up at 90 days, about 3 months after their initial visit, to see if the child has any persistent long-term symptoms that might be linked to initially having this disease.